Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, I'm going to be demonstrating a series of different neurological assessments you might want to use on your patients. Some of these do require the patient to be able to stand, and some of them do require the patient to be able to walk. So this is not going to be appropriate for everybody. Use your best judgment when choosing the different tests you want to use on your various patients. And always keep patient safety first, right? So if you're even questioning like, oh, I don't know if it's safe for me to do this, don't do that one. So the first one we're going to do is safe for everybody, is checking their level of consciousness. So is your patient alert? Are they asleep? Are they responsive to just calling their name? Are they responsive to touch? Are they not responsive at all? The next one we can do, let's say, okay, we've done our level of consciousness, our patient is awake. Now we want to know their orientation. So can they tell us their name? Do they know where they're at? Do they know the time? Now that one, time and date, is a little bit of a gray area because when you're in the hospital or if you're like taking care of a patient in a long-term care facility, the days kind of, mush together and people aren't as like, today is May 21st, 2021. They might not know things like that. It doesn't mean that they're confused. If they can get kind of close, maybe they know the month or maybe they know like the season. It's spring outside. Things like that, they know the year. Give them credit for things like that, even if they don't know the exact date and time. To perform the finger to nose test, you're going to have the patient put their arms out and bring their finger to their nose. And you want to do it alternating sides and see if you can get them to go faster. Somebody with impaired neurological functioning will not be able to do this successfully. In the finger-to-finger test, you're going to have the nurse put their finger up, the patient is going to touch their finger to the nurse's finger, then to the patient's nose, then the nurse is going to move their finger and the patient's going to have to follow. So let's demonstrate. I'll be the patient. To perform the Romberg test, have your patient stand straight with feet together like this and arms at their sides. And then you're going to ask them to close their eyes. So somebody with impaired neurological functioning might start to sway a little bit once they close their eyes because their balance is now a little bit off. To do rapid alternating movements, you're going to ask the patient to place their palms on their thighs, and then you're going to ask them to turn over to the back of their hands, and then you're going to have them do it quickly, like this. Another one we can do is finger to thumb. So have them touch their thumb with all their other fingers and see how quickly they can do it. Now I'm going to demonstrate the 12 cranial nerves. I do have a more in-depth video on the cranial nerves. If you want to check that out, I'll put it in the description box below. To test cranial nerve number 1, which is your sense of smell, you're going to use an object that you have readily available that's a common smell like coffee or, in our case, alcohol wipes. So what you'll do is you're not going to let the patient know what you have. You're going to ask them to close their eyes. Yep, I can smell that. It smells like an alcohol wipe. Now, this is not commonly done on every single person. Normally, we just ask if they're having any difficulties with their sense of smell. But if you're going to do it, using something like this is going to be really simple and easy. For cranial nerves 2 and 3, you're going to do PERLA, which stands for pupils equal round reactive to light and accommodation. So for this test, you're going to need to use your pen light. So what you'll do is you'll shine your pen light into one eye. That should cause the pupil to constrict, and it should also cause the other eye to constrict so that they're equal. To test for accommodation, you're going to ask your patient to look off into the distance, and you're going to use your pen light or your finger or some other object so they can focus on that, and then bring it slowly in closer to their face and kind of, about a couple of inches away from their nose. For cranial nerves 3, 4, and 6, you're going to do the 6 cardinal positions of gaze. So for this one, you're going to take either your finger or your pen light, and you're going to make an H, or you're going to make like an asterisk, and you're going to ask your patient to follow your finger with their eyes. It's very important when you do this test that the patient isn't moving their head along with it, just their eyes. Their head needs to stay straight. For cranial nerve number 5, we'll have to gather a few supplies. Basic things you will already have in your pocket, like your hammer. So we'll just use this part as our sharp, and then grab like a cotton ball for something that's soft. So what you're going to do is you're going to have the patient close their eyes, and then you're going to do a sharp or a soft, and the patient is going to have to identify, is it sharp, is it soft, and where on the face are you touching? Left sharp. Right cheek soft. Nose soft. Forehead sharp. Chin sharp. Left cheek sharp. Left cheek soft. When assessing cranial nerve 7, we are checking for the mobility in the face and also symmetry. So we want both sides to be equal. Think about somebody who's maybe recently had a stroke. They might not have that. So what are you going to ask them to do? Smile, frown, close their eyes really tightly like this, and puff out their cheeks. That's how you do cranial nerve 7. Cranial nerve 8 is your acoustic nerve, so it tests your hearing. And at this point, if they've been able to cooperate along with you, then they probably have good enough hearing to understand what you've been saying. If you want to test this a little bit further, you can do the whispered voice test, which is where you're going to stand a couple inches away from them, and you're going to whisper a simple command like, raise your hand. So have them close their eyes so they're not reading your lips, and see if they can follow that command.
Raise your hand.
So for cranial nerves 9 and 10, you're going to ask the patient to open their mouth and say ah, and then you're going to ask them to swallow.
Open your mouth and say ah.
Ah.
Okay. Now swallow.
Another test you can do for cranial nerve 10 is to ask the patient to clench their jaw as you palpate their jaw muscles.
Clench your jaw. Good.
For cranial nerve 11, you're going to place your hands on the patient's shoulders and ask them to shrug. You're going to compare both sides, making sure that they are equal.
Shrug your shoulders.
You don't need to provide a ton of resistance for this, just enough that you can compare both sides. Cranial nerve 12 kind of can go along with 9 and 10 when you ask them to open their mouth and say ah, because you want them to stick out their tongue. And when they do that, you want to make sure that their tongue is nice and straight and there are no tremors. People who have neurological issues might not be able to do this. Their tongue might be like this, or it might be kind of like where they can't keep it straight. For cranial nerve 12, you can ask the patient to repeat the words light, tight, and dynamite. And noting that their speech is clear, you can understand it, and you can tell the difference between the L, the T, and the D in those words. When doing reflexes, so you want to find the kneecap, and then you want to go about 2 fingers underneath and hit about right here. And with your hammer, you don't want to hit directly on, you want to hit a little bit more like an upward angle. When assessing somebody's deep tendon reflexes, we score it on a 0 to 4 scale. So 0 meaning nothing. You got no response whatsoever. That would be bad, right? Sometimes that is something that happens because of either disease or something that we've done. Maybe they've been put on a medication, like a narcotic, and they've had too much of it. Or maybe they're on something like a magnesium sulfate, which is common in labor and delivery. And they might have absent reflexes. That's not a good thing. So we want to make sure that our patients are not having absent reflexes. 1 is they have it, it's there, it's just a little slower than normal, it's diminished. 2 is normal. 3 is brisk. I do want to point out though that everybody is a little bit different, and for some people a 3 is their normal, so that's okay. 3 is not always indicative of an illness or disease or something bad happening. 3 could be their normal. And then 4 is hyperactive, very brisk. So this would not be normal. This would be very unusual and usually indicative of an illness. And one other little tip. In this video, I used a hammer, a reflex hammer. We don't always have those available. If you don't have a reflex hammer, in a pinch, if you need something to use, you can actually use your stethoscope. You can use the diaphragm and the bell of your stethoscope. Just make sure you're being gentle, you don't hurt the patient, and you don't damage your equipment. To assess clonus on your patient, take the palm of your hand and place it on the sole of their foot, and then have them dorsiflex back. If you feel a pulsation or like a little beat back on your palm, that means the patient is positive for clonus. Clonus is graded as +1, +2, etc. +1 meaning you would feel 1 beat back, +2 would be 2 beats back, and so forth. Clonus is not a good thing. It's not something we want to have on our patients. It is a precursor to a potential seizure. When assessing someone's gait, you're going to have them walk 10 to 20 feet. You're going to watch their arms swing at their side. It should be very smooth and easy. And then you're going to have them turn around and walk back. It should be balanced, coordinated, and smooth. Another test we can do is have the patient walk a straight line, heel to toe. To do the heel to shin test, you're going to have the patient use the heel of their foot and bring it up and down the opposite leg's shin, like this. Another walking test you can do is ask them to walk a few feet on their tippy toes, and then have them come back walking on their heels. So that was my video on how to do a neurological exam. Not everything I demonstrated in this video is something you're going to do every single time on every single patient. I was just showing you a variety of things you could do. So keep that in mind. Use the ones that are appropriate and safe for your patient when you're doing your assessment. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one. Another thing you can do for cranial ownership. No, it's not in the camera frame. Okay. Okay.
You're not following.
You're going way too fast. You're going way too fast. Just go like a normal pace.
Okay. Are you ready now?
Yeah, I'm ready. Did I do it or did it look weird?
I don't know. Can you see it? I can't. Okay.
You got to look at my eyes. Do my eyes look like they're following the pen?
I can't tell if the pen is off the camera.
Oh, I can't tell either because I'm looking at the pen. I'm not looking at the camera.
Can you see the pen now?
Yeah.
On the camera.
Yes.
Okay. Are you ready?
Yes.